A very good morning to one and all present over here. COVID, the new way forward. Today we are organizing a scientific session on new management of COVID protocols, how to go forward with COVID. So I'm very happy and I like to acknowledge the following things. Now, by and large, we are not against COVID vaccination. We are against mandating COVID vaccination. There will be no discrimination based on COVID vaccination status. Children shall not be compelled on COVID vaccinations in the name of public examinations. The Supreme Court has made it very clear that vaccination will be purely optional and never be mandatory. I am greatly thankful both to the government, people, and of course to the judiciary for listening to us. I have few more scientific data to help us all to manage COVID in a much more effective way. The first step will be judicial screening of COVID. So having seen in the previous words that both the government and the judicial department has now made a very clear statement that COVID vaccination will be purely optional. It shall not be mandated and people will not be discriminated on the basis of COVID vaccination status. Children will not be mandated to go ahead with COVID vaccination in the name of public exam threat. I have few more scientific data to tell to you to manage the COVID in the new way forward and in a more judicial way and in a more successful way. First, we need to have some judicial screening. So what is judicial screening? Let us not screen anyone and everyone. So whom should we screen? People having fever, breathlessness, some untoward change in their health. They are not doing as usual. Their food intake has come down. They are looking sick. We have no other doubts on any other illnesses apart from COVID. Alone should be screened for COVID. So who else not to be screened for COVID? At the entry and exit ports of airport, seaport, land port, they should not be screened unnecessarily. And certain companies are having few protocols of daily reporting system of screening for COVID-19, maybe by the COVID self-kit or by the RT-PCR kit. This should be stopped. And in all the hospitals, majority of the hospitals, inpatient and majority of the hospitals are getting COVID-19 screening as a routine for all admissions. So all these three has to be stopped. See, the first thing is entry and exit of ports, routine screening for COVID-19 should be stopped. Daily COVID screening reporting for jobs. You have to send your COVID-19 reports to daily report for your work, to daily report to your schools, to your office. You need to take a COVID self kit and then you have to go ahead. See, this COVID self kit can cause a huge biomedical waste burden in our society. And for hospital admissions, for any purposes, now we are doing a routine COVID-19 test. This has to be stopped. What is the consequence of doing routine COVID-19 test? You will damage the nasal mucosa by doing a routine COVID-19 test and thereby will spoil your respiratory immunity. And it will unnecessary COVID-19 screening will identify carriers as COVID positive patients and it can modify your destiny unnecessarily. So, as a next part of our discussion, management of COVID-19 patients. First, we need to categorize the patient as either sick or non-sick. If the patient is non-sick, no quarantine is required. How do I infer to my thoughts? The healthcare system is constantly seeing COVID-19 patients and they are not quarantined and they are not considered as a carrier for COVID-19. If you gently browse through the history, if you go through the history backside, 2 years back, hospitals in contact with COVID-19 were closed for at least 3 months. Doctors healthcare workers who were in contact with COVID-19 patients were quarantined for 14 days, were not allowed to come to work. All these rules have waned by time. Waned in the sense they have simply vanished. They have been stopped. They have been abolished. So if healthcare workers can be permitted to work in the society, in the community, and go back to their home after in getting contact with the COVID-19 patients, why not the COVID-19 patients who are asymptomatic, who are not sick, why do they require quarantine? This is a scientific question. If they are sick, they need to be admitted in a hospital, in an ICU, depending upon the requirement. So we need to be very careful by admitting the patients in the ICUs. So as a famous scientific terminology says, one size doesn't fit all. So generally the hospitals are admitting patients in the ICUs which were used to manage myocardial infarction, strokes, heart attacks, any other serious metabolic illness. The ICUs which are used to manage these diseases are used to manage COVID positive sick patients. Now we need to infer to a thought that the ICU that was used to manage other health disabilities cannot be used for COVID patients, because COVID ICUs needs to be ventilated. COVID ICUs needs to be open. Here ventilation is more important than temperature control, where temperature control is more important in managing metabolically ill patients like high glucose, high sugar, myocardial events, cerebral vascular events, where temperature control is more important than the ventilation control. But in COVID managing patients, the ventilation control is more important than than the temperature control patient, than controlling the temperature. So the ICUs, either there should be some separate ICUs to manage COVID patients, and the ICUs should be structured in such a way that it should be open, well ventilated. What is the consequence of a very ill COVID positive patient who is more sick? We advise him to undergo ventilation. That is, என்ன சொல்றாங்க, patient ventilator support la போட்டுருக்காங்க. The patient is put on ventilator support. So a well ventilated ICU is required, is a need of the hour for COVID positive ICU patients. So the COVID ICUs needs to be specially structured and designed with a low cost. It can be kept away from the urban cities, can be kept away from the metros. A simple open model, dormitory model ICU. ICU is, the name is intensive care and not, it is a infrastructure. It is not based on infrastructure. How much air conditioners you have, how much tiles you have, how much closed monitors, closed ICUs. Intensive care means managing the patient intensively, taking care of the patient intensively. That is what we mean for intensive care. Now the fifth point is personal protection kit. PPE should be abolished. As you all understand, the healthcare workers previously were using PPEs. Doctors, lab collection workers, who were using COVID positive patients or COVID negative for screening COVID patients. The lab workers were using the COVID protection kit. As you see by time, the personal protection kit, PPE, has generally vanished. The PPE's using system should be abolished for two purposes. One, it is not serving the purpose. Two, it can cause burden both to the healthcare workers by suffocating them, both to the earth by suffocating the atmosphere. It can cause a huge biomedical waste burden. Mask can hurt instead of helping. The usage of mask should be stopped immediately. Why? Because of the following reasons. Usage of mask can increase the hand-mouth contact ratio or the incidence. After wearing a mask, you are prone to use your hand over the mouth to gently rub the mouth, which will increase the hand to mouth contact, which is generally advised to be low in the terms of a pandemic. And wearing a mask can reduce the CO2 exit, can reduce the oxygen intake, can impair the respiratory system, can impair the respiratory system's immunity, humidifying mechanism, temperature control. In fact, the entire respiratory system can be spoiled by using a mask. Seventh point is attenders should be allowed to visit COVID positive patients. The best example is from government general hospitals, where attenders are allowed to visit COVID positive patients, which will prevent ICU psychosis, which will prevent dissertation, which will prevent depression seen in several COVID positive patients. By and large, the vaccines should be made optional. We respect the hard work and the tremendous effort made to invent the vaccines, but of course, health is an option where vaccines cannot be mandated. I'd like to end my talk by keeping few requests. Several people have violated the law. Only if you have vaccinated, I will make you work in my company. I will issue the salary. I will issue certain things. You will be able to enter the office. So all these people, as the Supreme Court has clearly said, the vaccines cannot be mandated. All these people have violated the law, and these persons have first to be educated. If they still continue to violate, they should be warned. If they still continue to violate, they should be penalized. The same will be holding good for schools. Several schools have vaccinated the children in the threat of public examination. The schools should be educated first. If still they violate, they should be warned. If they violate, they should be penalized. Several hospitals are charging more for treating COVID positive patients. Doctors, healthcare workers are seen as instruments in the God's hands. If we doctors, we healthcare workers want to preserve the same level of dignity that we have received from our brethren, from our community, let us identify antisocial, business-making people entering into the healthcare system who wants to make hay while the sun shines during the COVID period. The next wave comes, no problem. Follow the above said protocols. It is very, very easy to manage. My sincere thanks to my family, to my staff, who have withstood the times during the COVID, where I came out with a different ideology. I came out some with practical ideology. After the experience of handling more than 1,000 COVID positive patients, I was happy with the initial success that I was able to convince hundreds of people, including both my family, my staff, including my staff who are around 80 people in our center, and all our patients coming to my OPD who have accepted me for not wearing mask, for not using the COVID vaccination, who have accepted me as I am, who have respected my thoughts, who have respected the science inside me. As I always strongly believe in, the service you do to the least of my brethren, you do unto me. The service to God, service to mankind. The service to mankind is service to God. So I thank each and everyone for your patient listening. So let us go way forward. Let us manage COVID more effectively. Thank you and have a nice day.